Welcome back to Lab Talk, the podcast where we break down the science behind clinical laboratory testing and make it actually interesting. I'm Amber, and today we're diving into a test that plays a massive role in diagnosing bleeding disorders and monitoring heparin therapy, the Activated Partial Thromboplastin Time, or aPTT. Whether you're a seasoned lab professional, a student, or just a curious mind, this episode is for you. Let's get started. All right, let's start with the basics. The Activated Partial Thromboplastin Time, or aPTT, is one of the most frequently performed coagulation tests. It's mainly used to monitor unfractionated heparin therapy, but it also helps identify bleeding disorders related to deficiencies in the intrinsic coagulation pathway. Now, I know what you're thinking. Intrinsic, extrinsic, what's the deal? Here's the easiest way to remember it. The extrinsic pathway is triggered by tissue factor and is measured by the prothrombin time PT. The intrinsic pathway is activated inside the bloodstream and is what aPTT is all about. If there's a deficiency or dysfunction in factors 12, 11, 9, 8, 5, prothrombin or fibrinogen, the aPTT test will be prolonged, meaning something's off in the clotting process. Now, let's break down the name because it actually tells you a lot about the test. Partial Thromboplastin Time, PTT, was first developed in 1953 to detect hemophilia. Back then, scientists relied on the glass test tube to activate clotting. Then, in 1961, they figured out that adding a negatively charged particle, like kaolin, could speed things up. That's when activated was added to the name, giving us the Activated Partial Thromboplastin Time, aPTT. And here's a fun fact. While people often use PTT and aPTT interchangeably, aPTT is the correct term for the modern test. Now let's talk chemistry. aPTT reagents have two main ingredients: an activator. This can be kaolin, cellite, silica, or elagic acid, all of which provide a negatively charged surface to activate factor 12, and a source of phospholipids. These act as a substitute for platelet surfaces, allowing critical coagulation complexes to form. But here's where things get interesting. Not all aPTT reagents are created equal. Different brands use different phospholipid concentrations and compositions, which makes some reagents more sensitive to heparin, clotting factor deficiencies, or lupus anticoagulants than others. This is why every lab must validate its own reagents and establish a proper reference range for accurate results. So, why does all of this matter in the real world? Well, aPTT plays a critical role in the following three areas. 1. Monitoring unfractionated heparin therapy. Heparin is used to prevent or treat blood clots, and aPTT ensures the dose is just right. Not too little, not too much. 2. Detecting clotting factor deficiencies. Prolonged aPTT could indicate hemophilia A, factor 8 deficiency, or hemophilia B, factor 9 deficiency, among others. 3. Identifying lupus anticoagulants. If aPTT is prolonged and doesn't correct with mixing studies, it could mean the presence of antiphospholipid syndrome, which increases the risk of clotting despite the prolonged clotting time in the test. That's why interpreting aPTT results isn't just about the numbers. You need to consider the clinical picture and additional testing. All right, let's wrap this up with a quick recap. aPTT measures the intrinsic pathway of coagulation and is used to monitor heparin therapy and detect clotting factor deficiencies. The test works by adding a negatively charged activator and phospholipids to a patient's plasma, triggering the clotting cascade. Not all aPTT reagents are the same, so every lab must validate their methods and reference ranges. So the next time you see an aPTT result, you'll know exactly what's happening behind the scenes. Well, that's it for today's episode of Lab Talk. I hope you found this breakdown of aPTT helpful. If you enjoyed this episode, make sure to subscribe, leave a review, and share it with your fellow lab professionals. If you have a question or a topic you'd love for me to cover next, shoot me a message and let's keep the conversation going. Until next time, keep learning, keep questioning, and keep making a difference in the world of clinical science.